Hello, I'm Eric Hong, Executive Director of the Momiji Healthcare Society. I'm here to speak to you about COVID-19 pandemic as it relates to Momiji Healthcare Society and Momiji Seniors Residence again. It has been 7 weeks since we activated the pandemic plan at Momiji as the COVID-19 coronavirus pandemic arrived. The Public Health Agency of Canada continues to advise that the pandemic has not yet hit its peak. That means new cases of infection is expected to continue to an unexpectedly high rate for some time. Government at federal, provincial, and municipal levels are still warning that we cannot let our guard down when it comes to social distancing and to hand hygiene practices to curb COVID-19 spreading. This week, there are almost 5,000 people in Toronto infected with COVID-19. Of those, almost half are 60 years of age or older. This is a disease that is particularly bad for older people. Also of note is that to date, almost 300 people in Toronto area has died of COVID-19 related causes. There is currently no vaccine nor curative treatment for COVID-19. It is very important that we avoid the virus finding its way into Momiji, or at least delay it happening for as long as possible. In my previous messages, I have spoken about what we have been doing to reduce the risk of infection in Momiji. We are doing so by keeping our facility clean and sanitized, by reducing people traffic in and out of Momiji. We are reducing the need for tenants to venture outside of Momiji. We're minimizing situations where groups of people gather together, and we're screening staff and visitors to Momiji for infection risks. And we're asking families of tenants to not come to Momiji if they did not absolutely have to, and to bring and wear face masks when they are visiting. Many of you have heeded our call and cooperated with us. For that, we thank you. Many of you have also let us know you appreciated what we are doing and have made further suggestions. For all of that, we are grateful. However, some have found it very difficult to reduce the frequency of your visits to tenants in our residence. Others have not been able to find masks to wear. We understand these challenges, but we must ask you to help us to minimize the risk of exposing our tenants to COVID-19. If you must visit, please keep frequency to an absolute minimum, preferably no more than once a week if at all possible. If you have been shopping for a tenant, please encourage him or her to make use of our grocery shopping assistance service instead, so that you don't have to make shopping and drop-off visits to Momiji. If you must shop for specialty items for the tenant, such as Japanese food ingredients, if you have to do so, please drop them off at the screening table at our front entrance. Our staff will help bring them to the tenants, and therefore you don't have to come into the building. If you must come into the building, please bring and wear a mask. If you don't have a mask, we will provide one on a one-time only basis to one designated family visitor per apartment. Because we only have a very limited amount of such masks, once they are used up, we will no longer be able to provide them. We do not wish to deprive our tenants of family support, but preventing infection risk takes precedence. We will not be allowing visitors who do not bring and wear a face mask into the building. If at all possible, I encourage you to replace in-person visits with phone calls, video chats, and other virtual means of communication with our tenants whenever possible. If you think that our staff can help set up your tenant family member with these virtual technology, please let us know and we'll do our best to help you. Please allow me to remind you that almost half of all COVID-19 infections in Toronto are seniors. They are particularly vulnerable and also subject to the worst symptoms and outcome of the infection. For every 100 people infected, 6 have ended in death from COVID-19 related causes. Please cooperate with us in keeping every senior who lives in Momiji safe and well. Thank you.